The coronavirus disease, COVID-19, is an illness caused by a novel coronavirus called severe acute respiratory syndrome, SARS-CoV-2, formerly called 2019 nCoV, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. Retrospective investigations by Chinese authorities identified human cases with onset of symptoms in early December 2019.
COVID-19 has been on the lips of everyone ever since it was first reported in December 2019 out of Wuhan in China. And the World Health Organization was the institution that it was reported to as a new infectious disease that was rapidly spreading. And in under a couple of months, it had spread to multiple countries, just illustrating the fact that the world is indeed a global village, and with transportation, air travel, and high mobility of the world's population, within a few months, multiple countries had documented confirmed cases of COVID-19.
In Nigeria, the coronavirus disease was first reported on the 27th of February 2020 in Lagos State. Since then, the battle against the virus began.
So obviously, this was a new infection. The capabilities for testing were minimal at the onset, but countries rapidly developed their capacity, including Nigeria, to test and confirm cases of COVID-19. So we knew it to be an infection that's transmitted through the respiratory tract, presenting as a respiratory infection. But as time went on, we started seeing other clinical manifestations, clinical presentations of the disease. And so while majority of those who are infected would be either asymptomatic or in mild forms of the disease, there's a certain proportion, and this varies depending on the demographics of the population affected, and clinical status, being previous history of chronic illness and certain risk factors. So the majority would recover from the illness. But unfortunately, even those who are asymptomatic and in mild forms of the disease can transmit the infection. And so that's knowing who would then be infected and how that individual would respond to the illness has been a very confounding issue all over the world. And so across the world, especially in the Western world, we're seeing increasing numbers of cases, increasing numbers of deaths, and an overwhelming of health systems. So when you see an overwhelming of health systems in countries that had somewhat strong and robust health systems in place, then you can understand the concern early on in the pandemic for countries in the developing world, lower and middle income countries, and how they will be able to manage the outcomes of the pandemic. So fortunately, in Nigeria, with the Federal Ministry of Health and Nigeria Center for Disease Control and their experience in tackling infectious diseases, generally diseases like Lassa fever, cholera, measles, cerebrospinal meningitis, at least there was a strong response to COVID-19. There was a rapid increase in the number of states that built and developed capabilities to test and confirm cases of COVID-19 across the country.
Masks were introduced, with state governments imposing lockdowns, calling for restrictions in social gatherings. Washing of hands and the use of sanitizers gained prominence. As the fight against the virus waged on, different solutions have been sought, with many researchers seeking ways to put an end to the virus.
The government is already part of the WHO Gavi Alliance COVAX partnership. And from what we understand from the Presidential Task Force, vaccines will come from that alliance. Some of it from Pfizer in the first instance, and then from maybe various other producers of the vaccine later. But there is no clarity as yet as to when these vaccines would arrive Nigeria. So one of the issues raised with Mr. President is the need to accelerate the delivery of vaccines to the country so that it will be available to all our people. Those of us at the receiving end in the States know that this is an issue that we also need to ramp up our own preparedness in terms of getting our states ready for vaccine storage, particularly the freezers and cold chains that we require for that process. We need to get ourselves ready at the state level. The federal government can procure, but we would receive and administer in our various states, and there is a lot of work to be done in that respect.
Now, the largest number of vaccines we are getting is the AstraZeneca in Africa. And this AstraZeneca is made under license. It's a UK vaccine, but it's manufactured under license by the Serum Institute of India. So the Serum Institute of India is donating all these vaccines, and then the South Africans discovered that this vaccine had some weaknesses when against the own variant. You know, those of you who have heard of the South African virus variant will know that it's a peculiar variant by itself, and the South Africans said that it didn't seem to be very effective against their own variant. Now we turn to the World Health Organization and say, what do we do? They say, well, if you don't have that variant, don't worry, use it. In Nigeria, we do not have the South African variant. So use it, it will be effective. So therefore, we are using it because we do not have the South African virus variant here in our country. And if we start the vaccination on time and get Nigerians immunized, then they are immune. So even if the variant comes in later on, it probably will not have any effect. So it is not so effective in South Africa. It doesn't mean it's harmful. What it means, it may not be so effective. But here it is effective because that variant is not here with us.
Then came vaccines. Scientists and researchers came up with a perceived solution to the pandemic, and governments became tasked with the responsibility of administering the limited available vaccines. Deciding who should be prioritized before an expected mass circulation of the vaccines has now come up. According to state authorities, Nigeria's vaccine doses will be rolled out in 4 phases.
Our goal is to introduce the COVID-19 vaccine in a phased and equitable manner based on advice of the World Health Organization and the experience we have observed other countries to make, and ultimately vaccinating all eligible Nigerians within the next 2 years.
We have to give an exemption to the arrival of the vaccines because we put a gateway to drugs coming from Southeast Asia to avoid substandard falsified medicines. So we have to give a special exemption for this vaccine.
The first recipients will be frontline health workers and strategic leadership, followed by individuals aged 50 years and above. The third phase will cover individuals between 18 to 49 with relevant medical conditions, while the last group will be the remaining eligible population, which is made up of individuals ages 18 to 49 without relevant medical conditions.
This is 1, 2, 3 are different based on the number of subjects. Phase 1 is ask fewer people, phase 2 has more than phase 1, phase 3 has about 20-something thousand plus people. And when you have 20-something thousand people and they say 10 incidences or 10 side effects or whatever, statistically or epidemiologically, you categorize as risk or benefits rather outweigh the risk. There is no medicine that doesn't have side effects, especially when it's going through development. The advantage of Johnson & Johnson is that it is one shot. You don't need to come back. But that is if you get it quickly, we are expecting other vaccines from the Russian vaccine, Pfizer, BioNTech. We may get a little of that, but for the Johnson & Johnson and for the Russian vaccine, Sputnik, will get a lot, relatively more than Pfizer, BioNTech. So we are just expecting, but we are working hard to make sure that the next vaccine that will be approved, we will do due diligence.
All those in power must be the one to do their own vaccination publicly for everybody to see. Don't do it in the open. Don't go to Aso Rock and do it. It is after you have got your own that I will get my own.
As the rollout of the vaccines began across states, top government officials were among the first to take the jab.
The governor is about to be injected and it is done.
The Oxford AstraZeneca vaccine is said to have an efficacy of about 63% against the symptomatic SARS-CoV-2 infection. But how much protection can an individual get from it against COVID-19?
We must keep stressing that the vaccine or vaccination does not stop you from being exposed to the infection and does not stop your exposure becoming infection, but it stops you from your infection developing into a disease. That is the point. And so we must continue to wear a mask so that we don't get exposed. The vaccine was not designed to stop exposure.
There have been reports of deadly blood clots linked to the AstraZeneca COVID-19 in countries like Norway, Denmark, and Ireland, and this has prompted reactions back home, calling for a halt in the administration of the vaccine.
This talk about it has not happened in Nigeria. They have some mild reactions in Nigeria. It's just nonsensical. It doesn't make any sense. Are the people in Western Europe different human beings from us? No. Once the blood clots are occurring anywhere in the world, everywhere else, that vaccine must be stopped. The high pharmacovigilance has to be placed on it until you figure out who is at risk of the blood clots, because the danger of the blood clots will kill immediately. COVID might not even kill these people. The mortality rate is 0.0125. And you're now talking about blood clots. We already have a high predisposition to blood clots in Nigeria, just because of our food. Simple thing like you take food with crayfish. There is what we call the crayfish binding protein. If you eat it in large amount, it will start making your blood to clot. Think simple vegetables, you have okra, you have pumpkin, and all the vegetables can also make your blood to clot because they are high in vitamin K. So if you now introduce a vaccine at the population level that will even further complicate the already complicated situation of blood clots, we're going to have a total breakout here of blood clots, and people will be suffering strokes and heart attacks everywhere. And this is a permanent thing, because once you have that vaccine and the changes start occurring in your body, it will reset your entire clotting time.
Along with other health workers at the front line, Dr. Daisy Ore has had her jab of the vaccine and says she's not had any side effect.
I took the vaccine about 10 days ago, approximately, and I felt fine immediately. I took it a couple of hours, about 2 hours after taking it. And mind you, the vaccine that I took was the AstraZeneca vaccine, which is what was donated to Nigeria by the COVAX facility, developed by AstraZeneca and Oxford University. So I took the vaccine. About 2 hours after, I started feeling some soreness, some mild soreness at the location where I was injected. And I had been advised by the health professional who administered the vaccine that I should not rub the site of the vaccination. So I with that in mind, I just left it at that. But about 12 hours later, this was now about 11 p.m., I started feeling some slight chills. There was no shivering, there was no rigor, there was no sweating. But I just noticed that slight chill. So I took some paracetamol and I went to bed. And then waking up in the morning, there were no longer any. In fact, throughout the night, once I fell asleep, I wasn't disturbed in my sleep at all. Woke up and I felt much better. The soreness had reduced. And since then, I've had no side effects whatsoever from the vaccine. I've gone about my regular work and I don't feel any different to before I took the vaccine.
At a time in the UK, 5 cases of an extremely rare form of blood clot, cerebral sinus vein thrombosis, were reported among 11 million people who received the vaccine. The European Medicines Agency also received 13 reports of CSVT. Granted, that can occur naturally. No link to the vaccine has been established, with the EMA insisting that a thorough review was carried out and people can have confidence in the vaccine's safety and benefits. Does this mean Nigeria should go on with mass vaccination against COVID-19?
There are certain life processes, I would say, that render people vulnerable to blood clots. Okay. One major example is pregnancy. Pregnancy has a risk of blood clots, and I don't see anyone opting out of getting pregnant because there's a risk of blood clots. Another thing is contraception. Different means of contraception, especially the oral contraceptives, popularly known as the pills, also have risks of development of blood clots. Now, for most interventions, there are side effects. So these are the things that have to be taken into consideration. And so for individuals who may feel like they are at risk in any way, speak to a health professional to determine your level of risk and then weigh the benefits of the vaccine against your risk.
Well, the vaccine as one of the strategies to deal with the COVID-19 infection, is one, and I emphasize one of the many strategies. At the forefront of the strategy for dealing with the COVID-19 infection are the therapeutics, the drug you give to deal with this infection. So the truth of the matter is, vaccine is not that magic bullet, and it shouldn't be seen as such. It just has to be seen as one of the measures, and we have done very well so far with managing the mortality rate, the case spread in the country so far. Now, the introduction of the vaccine should have been under conventional medical knowledge to break the transmission in a high-risk group. That means you don't introduce vaccines. It does not exist in medicine to vaccinate the entire population.
They don't need vaccines to kill us. We eat too much of what they produce. They can kill us through those things. They don't need it. There's hardly anything that is on your table that is not imported. So why do they have to waste their time and allow their people to die? Before they send vaccines out here, we will do everything to ensure that vaccines are made available to every qualified Nigerian. And our intention is that in 2021, we will vaccinate at least 40% of the population. And in 2022, vaccinate another 30% of the population.
While the Nigeria Center for Disease Control has been in charge of Nigeria's coronavirus response in the areas of testing, communication and surveillance, the task of coordinating vaccination rests squarely on the National Primary Healthcare Development Agency.
So the clock starts ticking when we have those quantities of vaccines that we can actually begin to make a huge dent in terms of coverage of Nigerians. We're also mindful that we still have to do a lot of work to overcome the vaccine hesitancy that we're already seeing, the misinformation, the conspiracy theories around the COVID-19 vaccines. And we do not take for granted that all Nigerians understand the principles around vaccine production. That is why we know we have to do the hard work, drawing on our lessons of the past. We want to succeed. And this is why everybody has to be on deck, must have all hands on deck to make sure that we deliver these vaccines despite all of the challenges that we will be facing.
I think we can learn a lesson from what happened in polio. I mean, you remember in 2003, there was a mass ejection of polio vaccine in the north. But we overcame that one by getting, as my colleague has said, getting down to the people, get the information to them, get the facts to them, and get the people who know them to talk to them. I mean, I'm not talking of the ministers staying in Abuja and talking to people in my village. You come to my village head, you come to my ward leader. Those are the people you need to convince so that they can get, because the people trust those people, because they see them on a daily basis. They don't see the minister. I mean, just like my brother was saying that we are talking about e-registration. How many people are going to e-register? And one other point I think I need to quickly mention is the fact that the COVID vaccine is only going to give us about 20% of what our needs is. My worry is that, are we sure, I mean, it took us how many weeks or months to get this one? Who knows when the next batch will come? Have we synchronized that activity so that there's no stop in the rollout? So that by the time the 3.9 million is finishing, the other one has arrived. And if it is not going to arrive, this is the time for my government to go out and purchase vaccines, to stop in case of any gap that is going to come. Otherwise, if we have gaps in between the rollout, we're going to lose people.
Despite the outlined phases, some say that there are challenges in the process.
Yeah, the thing is, when I registered for the vaccine through that website, I chose a site that was, okay, so by the time I put in my office address and everything, it came up with a health facility that was close to my office, right? Only for me to go there and they hadn't received the vaccines. So because they hadn't received the vaccines and there were a lot of other people who had registered in the place, coming and going, checking what's happening. So at that point I said, well, at least I know that National Hospital is carrying out the vaccine program. And as a health worker, I just took my ID and I went to National Hospital. Since I had already registered, I now re-registered for National Hospital, and that's how I got it. So what you're saying is perfectly right. The way we structure some of these delivery programs is they're not people friendly. That's the truth.
Renowned virologist Professor Oyewale Tomori wants the government to ensure the right policy on COVID-19 vaccination is put in place, with major priority on medical research.
The people who are producing vaccine now didn't start yesterday. 50, 60 years of consistent support to science and research. So when you're talking of homegrown, the environment for homegrown is not there. If we start now, maybe in another 10 years, we'll be able to do that. But right now, with the level of support, what I call toxic environment that we have in Nigeria for research and development, that's what is killing us. It is not that we don't have the talents. The people are there. Experts are there. Because when they go out to outside, they go to the diaspora, they excel. You hear many of Nigerians who excel in there. It is not because they are outside the country, it's because the environment allows them their talent to show. We have talents in the country, but we don't have the enabling environment. I call our environment toxic for research, and that's what is killing us.
At the moment, the Nigerian government says locally made vaccines are being developed and will soon be ready for trials. But while at it, people must do all it takes to protect themselves and ensure that this pandemic era becomes history as soon as possible.